Thank you for joining International Medical Corps for our COVID-19 learning series comprising 5 webinars on the most critical aspects of the coronavirus pandemic. My name is Mara Buchter, and I am the Deputy Director for Learning at International Medical Corps. And this session is being co-facilitated by my colleague, Ryan Bresnahan, who is our Training and Operations Officer in the Emergency Response Unit at International Medical Corps. Now I'd like to introduce our speakers for today's session, Mental Health Considerations for Healthcare Workers. We have 2 subject matter experts in mental health and psychosocial support, one to speak from a global framework and the other to the nuances of healthcare workers here in the U.S. Claire Whitney is a licensed social worker with extensive experience in the development and implementation of mental health and psychosocial support services with diverse and vulnerable populations in emergency and post-conflict contexts. Claire's been working in the humanitarian field to support MHPSS initiatives across the globe for over 12 years. With International Medical Corps, she serves as Senior Global Mental Health and Psychosocial Support Advisor, providing technical support and programmatic guidance for teams implementing a variety of global mental health initiatives. Sonali Gupta is a licensed clinical psychologist with a specialization in global mental health and trauma. Dr. Gupta has over 15 years' experience in mental health and psychosocial support programming in humanitarian contexts in the Middle East, Africa, South and Central America, the Caribbean, and Eurasia regions. We're really excited to have these highly skilled speakers today. Before we get started, first, a little bit about International Medical Corps. We are a global humanitarian organization dedicated to saving lives and relieving suffering. Established in 1984 by volunteer doctors and nurses, we are a nonprofit with no political or religious affiliation, and we now have more than 7,000 staff members around the world, more than 90% of whom are local to the countries in which they work. Our mission is to improve the quality of life through health interventions and related activities that strengthen underserved communities worldwide. With the flexibility to respond rapidly to emergencies, we offer medical services and training to people at the highest risk, always working to strengthen local healthcare systems and promote self-reliance. In alignment with our mission, International Medical Corps is responding to the COVID-19 pandemic around the world, deploying medical supplies, training health workers, setting up triage and screening sites, and more. Together, we're ensuring that people receive the medical care they need while keeping health workers safe. In the U.S., International Medical Corps is increasing patient capacity at hospitals, delivering training and information sessions for health workers, and we're ready to deploy emergency medical teams. I'd now like to turn it over to Claire and Sonali for their presentation, Mental Health Considerations for Healthcare Workers.
Hello, everyone. We'd like to extend a really warm welcome to all of you today. We are in great appreciation and admiration for the important and life-saving work that you're doing and appreciate your taking the time to join us. Just to give a brief overview of the different topics we'll be covering during today's presentation, we'll first begin by looking at stressors and challenges related to the COVID-19 pandemic, and then looking to common reactions to stress and also identifying negative reactions to stress, and then exploring different individual coping mechanisms and self-care promotion, and then looking at ways that organizations can promote team well-being as well as staff care, and finally, introducing some different well-being resources that might be helpful for you.
Good morning. I would also like to add my recognition and thanks to the healthcare community and first responders that are providing vital and life-saving services at the risk to their own well-being. As we all know, there are a number of stressors and challenges associated with the coronavirus pandemic. We wanted to name some of these stressors We recognize that we're not providing a comprehensive list, and you may think of others that are not represented here. This slide recognizes stressors experienced by the general population, starting with the interruption in daily behavior patterns and daily routine. Social support and social contact are core to emotional well-being and are especially important in mitigating the negative effects of stress. Stay-at-home orders, quarantine, isolation, and social distancing all impact our ability to access social support at this time, and at a time when it is especially important. These measures can result in feelings of loneliness, and this is especially important to note, as there is a robust body of research that indicates that loneliness negatively impacts both health and lifespan. An additional stressor is the threat of sustained duration of the pandemic. This is also a time of uncertainty during which we may experience a lack of control over aspects of our life. Our sense of personal control, meaning the belief that I as a person can control and shape my life, can be impacted at this time. Research indicates that having a high sense of personal control is related to proactive behavior and positive psychosocial outcomes. Control is linked to being able to take preventative action and to feel healthy, whereas an impairment of control is associated with stress, anxiety-related disorders, and depression. With regards to interrupted education, I just wanted to highlight that for children and adolescents who receive meals at school, school closures often present a serious risk to these children's health and well-being. There are, of course, economic concerns resulting from job loss and decreased income. A March 30th NBC News article indicated that the Fed estimates that the coronavirus job losses could total 47 million, and that the unemployment rate could reach 32%. Individuals who have recovered from coronavirus and individuals who are associated with persons exposed to coronavirus, such as healthcare workers, are facing stigma. For example, in a recent daily briefing by the governor of Illinois, he indicated that there had been reports of nurses being evicted by landlords and tenants due to fears that they might be carriers of the virus. Asian Americans and Pacific Islanders are experiencing increased racism because the initial spread of COVID-19 occurred in China. And lastly, price gouging, hoarding have been additional stressors which only serve to exacerbate existing disparities and in already vulnerable populations no longer having access to food and basic needs. In terms of stressors and challenges that originate from systems responsible for protecting the population and ensuring an appropriate response, we have inconsistent and often contradictory messages about COVID-19 and the response to the pandemic. This disparity in information has been especially visible between the federal government and public health experts. So, for example, recently the federal government was indicating that the stay-at-home order would be rescinded and that bars and restaurants would be open after Easter, whereas public health officials were indicating that these measures should be extended, and if they were not, it would exacerbate the health crisis. Examples of misinformation on media platforms include the use of silver or bleach as a preventative to coronavirus. Another example was the touting of hydroxychloroquine as an effective treatment for coronavirus without it having undergone appropriate clinical trials. As you may know, this resulted in the hoarding of the medication and in a shortage for individuals diagnosed with lupus and rheumatoid arthritis who depend on this medication. Accurate information from trusted sources is especially important at this time to not only manage and decrease anxiety, but also to ensure that individuals, families, and communities are informed about and adhere to best practices to ensure their physical and psychological health and well-being. Information that is not consistent, such as unclear and changing recommendations, can result in disorientation and social disorganization. Another significant challenge is the lack of coordinated response between federal and state governments, and inconsistent and uncoordinated responses across states, coupled with a lack of guidance from federal government to state leaders. The President signed an executive order invoking the Defense Production Act on March 20th. The reason this is important is because the law gives federal government control during emergencies to direct industrial production. So this has implications for addressing the shortages in masks, gloves, ventilators. However, to date, this particular law has not been fully enacted. And the lack of involvement of the federal government in the procurement and distribution process means that these products aren't necessarily going to the cities and states that most need them right now. Tied to this is the lack of clear supply chain, allowing products such as masks and ventilators to be distributed efficiently and in accordance with need. Here we've listed stressors that are particular to healthcare workers, and these include shortages of tests, personal protective equipment, and ventilators, bidding wars between states and federal government for ventilators and PPE, an increasing number of individuals affected by the coronavirus, which is placing an incredible burden on healthcare providers and overstretching health systems. This, of course, contributes to concerns about the healthcare system's capacity to absorb the number of individuals needing treatment. Risk of infection and fear of infecting significant others is another stressor, which becomes all the more real, given that healthcare workers are contracting the coronavirus. The emotional impact of facing illness and death and what is termed moral injury are additional stressors. Moral injury refers to psychological distress that results from actions or a lack of action that violate a person's moral or ethical values. So, for example, in this context for healthcare workers, having to make decisions about how to allocate limited resources to individuals with equal needs. And a discussion that's manifested recently is how do we decide who receives ventilators?
So now we're going to provide an overview of common reactions to stress. It's really important in times of distress and unusual circumstances such as these for us to understand and help really contextualize and normalize a range of different emotions, thoughts, behaviors, and also physical symptoms or even spiritual dimensions of what this stress might entail. So we're going to present initially overall globally common reactions to stress and then look more specifically at what is to be expected and perhaps many are experiencing specific to this pandemic. From an emotional side, many people may be experiencing anxiety, fear, and worry. And of course, this is completely understandable and to be expected during a pandemic like this, but also when there's so much uncertainty and fear all around. People might be feeling anxiety, more generally speaking, when they wake up in the morning and feeling a bit of not being at ease and feeling a bit shaky, or there might be anxiety and fear very specific to specific concerns, specific apprehensions, and specific personal or professional dimensions of their daily lives and what work might entail. Many might also be experiencing feeling down or depressed, feeling quite sad, even if there's not really a clear link as to why they might be experiencing those feelings, or feeling a bit numb and quite emotionally disconnected. Others might be feeling a lot of pressure or feeling quite overwhelmed with the situation, feeling also a lack of control. And this can really weigh heavily on a person's emotional well-being, is feeling so out of control and quite overwhelmed with the situation around them. Some might also experiencing mood swings or shifting of emotions, might be feeling okay in certain parts of the day and then feeling quite emotional in other parts of the day. And again, that's perfectly to be expected. Others might be feeling a bit distanced or alienated from others. You know, some are less able to articulate or identify what this sort of surge of emotion might entail and what it means, and may not know how to connect with others on it. And for others, there could be feelings of anger, irritability, or hostility. And again, these are perfectly normal within reactions to stress that people might feel. When it comes to how people are thinking during stress or stressful incidences, Some might notice difficulty concentrating, whether, again, it's for a very specific task or more generally speaking, a lack of being able to keep focus on a conversation or tasks at hand. Others might experience difficulty making decisions or feeling like there's too much pressure and it's hard to take a decision. Others might be feeling sort of mentally overwhelmed. There's such a surge of information that we're all taking in, and it can be very cognitively or mentally overwhelming. This can also, of course, link to a lot of worry, very practical worries, as well as worry that might be linked to fears and uncertainty again. And others might notice that they're forgetful. And this, again, is another dimension of different sort of cognitive ramifications of stress that are to be expected. When we're thinking about how stress and stressful experiences might link to behavior, we might notice as well that there's irritability and reactivity with loved ones or with colleagues, with friends. We might notice as well different changes in sleeping patterns, whether it's sleeping too much or not sleeping enough, or having difficulty staying asleep through the night. There might also be disruptions in traditional eating patterns. Again, some might cope by overeating or stress eating, and others might not be feeling hungry at all or might avoid eating proper meals throughout the day. There might be avoidance of certain places or people that are associated with the stress that's being experienced. And some might turn to more maladaptive coping, like alcohol or smoking or even drugs, to try and escape those feelings of stress. Many will also feel physical symptoms of stress, and this can present itself in the body in a multitude of different ways, from headaches and dizziness to muscle tension, back pain, pain in different parts of the body, stomach and digestive problems. Some might feel chest palpitations, and others might experience sexual problems. And again, these are all to be expected with stressful experiences. And we want to recognize, in particular for healthcare workers, it is completely normal and understandable in this very unprecedented time to feel constant worry and feelings of helplessness, especially when lives are at stake and supplies or ability to support are limited, or different constraints might prevent people from having the type of power and control over the situation that they might want to have, which can, of course, lead to frustration, also a sense of constant awareness and vigilance and kind of having a difficult time turning off. And this can also lead to weaker social and family supports if people especially are having a hard time processing their stress or talking about it and connecting with those that they love and those that they turn to for support. And others may also feel like there's just not enough personal energy to have those connections or to take care of themselves or take care of others. And especially, there are very specific fears that are understandable connected to this pandemic about feeling scared of catching the virus and becoming sick or possibly dying, fear of approaching healthcare facilities as symptomatic or due to exposure concerns, fear as well, I'm sure, for healthcare workers once they go home, if they fear they might infect those that they love, or if that alters their relationships with those that they go home to, fear of losing loved ones, or having to care for others, especially with infection in their personal lives, and fear of reliving the experience of any other previously stressful experiences on top of what they're currently going through. It's important as well to identify that there are limits to what can be considered sort of normal and understandable stress and the type of stress that becomes toxic or negative, and to be able to identify signs and symptoms. So there's cumulative stress, which is the result of prolonged and accumulated stress and fatigue and association, especially through work, to a lot of stressors that can lead to a lot of physical and psychological fatigue. Whereas burnout is something that is more of a more deeply pronounced emotional and physical and mental exhaustion that is typically linked with work itself. It's important to note as well, the World Health Organization actually recently identified burnout as the formal classification of a disorder associated with chronic workplace stress that has not been successfully managed, resulting in feelings of energy depletion or exhaustion, increased mental distance from one's job, and feelings of negativity or cynicism related to work, and reduced professional efficiency. Critical incident stress is the stress that's caused by extraordinary events, whether it's related to trauma, loss, assault, conflict, or a variety of any other very different psychologically stressful incidences with negative outcomes. And that's important as well to recognize if there's been a particularly troubling or potentially traumatic incident that's occurred. And finally, I just wanted to introduce the idea of vicarious trauma. And this is linked with helping professions in particular. Sometimes it can relate to counselors, but it can also relate to other helping professions, specific to those who are working with people experiencing suffering or trauma and related pain and fear or terror, and the empathic link that goes between the helper and those that they're trying to help, and a sense of connection and commitment or responsibility to help that actually can lead to symptoms of traumatic stress and psychological or spiritual suffering. So this is just an overview of different types of negative stress to be aware of and to potentially identify should these symptoms occur, whether you notice it within yourself or those that you work with.
In times of stress, our capacity to cope and engage in self-care is especially important. And here we'll be first talking about coping and self-care at the individual level. So first starting with understanding what we mean by coping and self-care. Coping refers to skills and strategies a person uses to manage stressful or difficult situations. And self-care is the practice of taking an active role in protecting your own well-being, especially during periods of stress. These two ideas are connected in that positive coping strategies can also be strategies of self-care or can help support self-care. So, for example, exercise can be a way of coping with stress and also a self-care strategy. It's important to note that coping and self-care strategies are particular to the individual. And what I mean by this is that what works for you may not work for another person. And so this means that each one of us needs to identify what specifically is going to be effective for us. It's also important to note that self-care and coping strategies evolve and change over time and are dependent on our life situation. So, for example, a person's approach to self-care in their early 20s may be quite different to in their 40s when they may be balancing a career and parenting. I also wanted to highlight that it's common for us to develop negative coping strategies. Some examples are alcohol and drug use. And these are often what we think about when we think about negative coping strategies, but others can be overeating, overspending, and even sometimes excessive engagement in what is considered a self-care activity. So, for example, exercise would be a self-care activity, but over-exercising can become a negative way of coping. It's important that we each identify the ways in which we cope that may not be helpful and may even be harmful to us. It can be helpful to think of coping and self-care as falling into the categories listed here. So, for example, under emotional and cognitive, engaging in activities that stimulate our minds would be an example, or engaging in activities that result in positive feelings. The second category is behavioral. Examples that are relevant to this context are social distancing, which we can think of as a form of self-care, as well as accessing social support and connection through virtual meetings with family and friends. In terms of the physical category, examples are exercise, appropriate nutrition, and getting enough sleep and rest. And lastly, under the spiritual category, examples would be spiritual and religious practices such as prayer and meditation. So in terms of self-care, what is first needed is intention or a desire to take care of our well-being. This desire then motivates us to engage in actions that support and promote our well-being. We first need to nurture and grow this desire. Secondly, self-awareness is important. This includes identifying causes of stress, reflecting on and being aware of how stress manifests for you personally, and also developing an understanding of what is helpful to you in terms of managing and mitigating stress and supporting your self-care. I've included here a few questions that might help you with the reflection process that hopefully will support gaining some awareness and with identifying your own self-care strategies. So for example, thinking about what helps you relax, listing the positive coping strategies and self-care strategies that you already use, identifying those situations that make you feel stressed, understanding and asking yourself how stress affects you emotionally, physically, spiritually, and in your behavior. Who can provide you with support, and also thinking about what helps you feel hopeful. As mentioned previously, social support and connectedness are especially important at this time. While your face-to-face interactions may be limited, you can use phone calls, text messages, video chat, and social media as ways to stay connected socially. Examples are people getting together for virtual book club meetings, coffees and meals with friends and family. Core to self-care is the ability to recognize, to self-regulate, and to soothe anxiety and stress in healthy and adaptive ways. I want to emphasize physical safety here. I think it's particularly relevant for healthcare workers in this context. And here I mean having the means to protect yourself from the virus. So in other words, having adequate PPE. Given the uncertainty and the lack of control over many areas of our lives at this time, it's especially important to focus on what we can control. And this includes our thoughts, our emotions, and our behaviors. So for example, in terms of our thoughts, maybe limiting the amount of time that we spend worrying. In terms of emotions, engaging in activities that solicit positive feelings, and seeking out social support. And in terms of behaviors, again, engaging in activities that support our self-care and that are productive. The basics of self-care include exercise, appropriate nutrition, and getting enough sleep and rest. And so if anything, this is a good place to start for yourself. So if you're looking to start with your self-care, think about these areas: exercise, appropriate nutrition, and sleep and rest. Creating and following a daily routine is also vital. It helps both adults and children preserve a sense of order and purpose at a time of uncertainty and unfamiliarity. It's recommended to reduce the amount of time spent watching, reading, and listening to news, particularly news that elicits feelings of anxiety and distress. Instead, seek limited updates at specific times. So for example, once in the morning, once in the early evening, and avoid news at bedtime. Seek information with the purpose of taking practical steps to prepare your plans and protect yourself and loved ones. And seek information from trusted sources like the WHO and the CDC so that you're able to distinguish facts from rumors. This is because facts do help us decrease anxiety. And then lastly, engage in relaxation and healthy pleasures. And I've listed a few examples on this slide. When a person is struggling, their ability to accurately monitor and manage their well-being can become impaired. So at these times, professional support from a mental health provider can be especially helpful. I wanted to highlight that at this time, a majority of insurance companies are covering the cost of telemental health services in an effort to allow individuals to access behavioral health services virtually. Training and supervision are key supports that contribute to providing providers with feelings of competence in their work. A realistic sense of competence contributes to decreasing possible anxiety in the face of high needs. And lastly, replacing negative coping strategies with healthier alternatives and having realistic expectations and balanced priorities are also important. When you're developing your self-care practice, it is strongly recommended that you identify strategies and activities that are firstly realistic and secondly easily integrated into your life. These can be small actions that are easily absorbed into your daily routine. So for example, making sure that you're drinking enough water in the day, taking a 5-minute break every few hours, taking a minute to do some deep breathing. If you're too ambitious in your self-care goals and are unable to achieve these goals, it can result in your feeling discouraged and in decreased motivation to continue with self-care activities. But if you choose small and achievable self-care strategies that you're not only able to achieve, but that you experience the benefits of, this will further encourage you to continue with your self-care activities. I included this schematic once again because I've used it as an easy way for people to develop an individualized self-care plan. So you can write in one or more self-care strategies in one or more of these boxes. Again, just remember to choose self-care activities that are realistic and easy to achieve. They should not be an added stress or feel burdensome, but rather something that brings you relief, relaxation, positive feelings. So again, I recommend that you not be too ambitious. The reason I suggest using a simple written plan is because it can be a helpful reminder. And it also serves as a way to reinforce that intentionality that I mentioned previously.
So now I'd like to turn to the topic of staff care and how to promote staff well-being as well as team well-being and how staff can take care of each other. We do want to highlight that the psychological well-being of all healthcare staff should be an organizational priority always, but especially during very, very difficult and challenging times. We do want to highlight as well, it is so important for any healthcare worker or anyone in the helping profession to feel like they are doing well psychologically, physically, mentally before they're put in a position of trying to help others. And this is something that really we hope organizations can take to heart and prioritize. There is ample guidance to support such organizational initiatives, whether it's through human resources or also through those in leadership roles, those that are in management positions, supervisory positions, recommendations to really help promote staff well-being and develop different ways that team members can support each other. There's some very interesting guidance that came out from the British Psychological Society specific to COVID-19 around principles of promoting staff well-being during a pandemic. So for those that are in leadership roles, having very clear, visible leadership is so essential, especially during a time where there is such overload of information, such overwhelming emotions and fears that are associated with the pandemic, and fears as well specific to those that are in healthcare provider roles and first-line responder roles. It's so important to know that there's solid leadership, and that those that are in leadership roles are available and offering support, who are guiding staff to various resources that may be available to them to be able to take care of themselves and to also take care of their staff members. Also endeavoring to tolerate and manage uncertainty for those that are in leadership roles and for their staff. And accepting as well that it's perfectly understandable and not possible to have all of the solutions all the time. It's important to ensure very clear and consistent communication to staff on a very regular basis in clear and concise ways, and to actively encourage staff to come and feel open and safe to express any fears and concerns that they have, and important as well to listen with patience and with compassion. These are such difficult times, and it's so essential for staff members to feel heard and to feel supported. It's also critical to ensure consistent access to physical safety needs. Of course, physical and psychological are interrelated, and staff need to feel safe. Of course, it's so essential to ensure adequate PPE and time and space for breaks, adequate training so people feel prepared for the different challenges and different potential scenarios they might encounter. Having a confidential place, whether they want to just take some downtime to rest or relax, or whether they do need a private space to cry or to practice any of the self-care strategies that my colleague presented. It's important as well to ensure that staff members have 24-hour access to food and drink so that they can do everything they can to take care of themselves. It's also essential, despite the immense need of all hands on deck during this emergency, to ensure that staff are really allowed the adequate time needed to rest, for sleep, to not work very long shifts or back-to-back shifts, so that they have time to take care of themselves, and also access to a centralized hub of simple psychological resources. And we will be sharing some with you just as an example, but there is a lot that can be done to really provide various support to staff that they can access. When possible, it's also really essential to offer psychological support to patients and families. So as healthcare workers, of course, ensuring the well-being of patients and their families who are struggling to understand what the implications of this virus might mean for their loved ones, especially if lives are at risk and especially if there may not be an opportunity to say goodbye properly or to have a proper burial. These are immensely stressful components of this particular pandemic. And so if there are ways of creating systems of communications between relatives and loved ones and any clinical staff, whether they're at hospitals or other community-based clinics, but also between the relatives or loved ones and the patient, to really try and promote positive sharing as best as possible, despite the very, very challenging circumstances. It's also very important to think about ways for staff to manage end-of-life care in a dignified manner, whether family is involved or not. Really, these are some of the most trying of times, and it's so important to ensure that everything is done to promote dignity and best practices for how to address these very serious milestones in people's lives. In leadership roles, it's important as well to normalize psychological responses for staff. So understanding that stress responses are common during such unprecedented crises, and how important it is for staff that you support and supervise to care for themselves, and sharing any resources that are available to them as an option for them to pursue. But of course, it would not be recommended, for example, to mandate that anyone seek psychological support, but rather to make them aware of different resources that are available to them should they like to pursue those options. And it's important as well to have a sort of list of resources about different psychological services that are available, whether through the organization, through insurance plans, or any other type of vehicle for people to access care, and to, if possible, have a consultant or other staff psychologist, if our resources permit, to help advise organizations on how to best promote well-being. Another really critical component is looking at how to support team care. Healthcare workers are in it together. Healthcare workers understand as well the very, very specific and very real stress and anxiety and sense of commitment, but also lack of control that they might feel during these very trying times. So being able to connect team members with each other so that they can support each other is a really beautiful way as well of promoting staff well-being. And this can be done in a few different ways. There's a buddying model so that each day pairs of staff members are connected with each other with the explicit idea of looking out for your buddy and making sure that your colleague is seems to be doing well, and to check in with them, ask how they're feeling, ask how they're doing. This is a very effective way of just making sure that people are looking out for one another. There are also peer support groups that can be established, which can be a really nice model as well to promote connectedness in a more group format. So this is a valuable way of bringing people together for those that are affected by a similar set of concerns, so that they can explore solutions to overcome shared challenges, and to also feel support and connectedness with others who are going through very similar experiences and stressors, and who may better understand what that means and how it might be impacting them. So it's run by members, by staff members, and it would allow them to benefit from support from one another, but also really to look at how they can encourage other staff care members to help take care of one another in a sort of cascade fashion. So there are a lot of different possibilities of how to promote team care and staff care in this way. And in doing this, it's also very important to ensure that there are protected and confidential spaces to allow for staff members to come together, even for limited periods of time, and to also ensure that staff feel they have the approval and support from their supervisors to partake in such support activities.
Our final two slides consist of some resources. We wanted to provide you with resources that are free and available online, and that we hope will be helpful to you. So starting with a reminder of health professionals unions that can act as a source of information, but also can lobby on your behalf. On this slide, we've indicated a mindfulness app and meditation apps. And here we have some apps supporting sleep, self-care, and some exercise options. I wanted to note that these resources are also included in the handout that is in the files pod. It's in the Stress and Symptoms Wellness Resources handout, and you are able to download both of those handouts, so you have access to these resources. Thank you so much, and I believe that we are now inviting questions.
Okay. Thank you, Claire and Sonali, for the excellent presentation and all of those useful tips to get through this time. Now, what I would like to do is turn this over to Ryan Bresnahan, who will facilitate our Q&A. So please enter any questions that you have for our presenters into the chat box.
Great. Thanks so much, Maura. So in the chat, if you would like to direct a question to either Claire or Sonali, please do so when typing. Otherwise, we will direct questions according to their areas covered during the presentation. So we'll be monitoring the chat for the next couple minutes for questions for our two speakers. So the first question is, how can non-health professionals encourage health workers during this time to ease their stress or anxiety? So I'm going to direct that question to Claire with support from Sonali.
Sure. So there are a number of ways that non-professionals can use very skills of empathy, of active listening, of support and connection to be able to promote well-being of others. So a lot, and you'll see with the handouts that we've provided as well, there are very clear recommendations about how people can promote positive coping mechanisms and understand and identify signs and symptoms of distress. So this type of guidance is quite universal and does not require a specialization to offer support. Now, what might be interesting as well, there are training and capacity building opportunities that have been developed as well. Should there be more dedicated training and resources available to build the capacity of non-specialists to offer support basic psychological support. The World Health Organization has developed such materials, but there really is a wealth of materials and resources out there to help guide at differing levels of specialization, how they can offer support and guidance to those who might need it. And Sonali, please feel free to share any additional reflection.
Thank you, Claire. I don't have anything more to add.
Great. Thank you, Claire. Our next question I'll direct to Sonali. And what language do you recommend to validate appropriate fear while discouraging harmful obsession and panic?
Thank you, Ryan. So I think that I'd want to understand a little bit more about how the person is expressing their fear and what is meant by obsession and panic. In terms of fear, is the fear fact-based, or are there elements that are exaggerated or unrealistic? I'd want to also understand what type of messaging the person might best respond to. So some people respond well to receiving factual information in a concrete way from reliable sources, and other people respond better to receiving emotional support when experiencing feelings of anxiety and fear. So I think the idea, I would go back to what Claire said, is from a place of empathy and active listening to try to understand what are the fears and concerns, what is motivating those fears and concerns, are they realistic, and how best does the person respond? Is for example, providing them with fact-based data something that might be helpful. I would also consider whether, when you mention harmful obsession and panic, is this moving into an area? Is it severe enough that professional help might be appropriate, even maybe for an assessment? So I think degree to which the obsession is harmful, or degree to which the individual is experiencing panic, is there a need to connect them to a mental health professional? And so again, I would say that there are opportunities now to engage in telemental health. Claire, please feel free to add to that.
Yeah, I think you did a great job responding to that. Thank you.
Great. Thank you, Sonali. Our next question is, how can we decrease fear of death from COVID-19? I'll direct that one to you, Claire, again with support from.
Sure. That is a very, very profound question. And what I would say very openly and honestly is I think this pandemic is understandably putting our own mortality in the front and center of everyone's minds. It's very natural to be scared. It's natural to, and also helpful to be aware of risk. I think linked back to what Sonali is saying, it has to do with the degree to which fear or related behaviors, thoughts, emotions are impairing one's daily life. So it's important to understand what are sort of the fact-based levels of fear, understandably as well specific to those that are in the healthcare profession. Those are the staff that are putting their lives the most at risk in a very brave way. It's important, though, to understand that, there is an organizational responsibility to ensure that staff have every access to physical safety and PPE and everything that is essential to ensuring that they are as protected as possible, in addition to the training that's involved. But when we're talking about fear of death, more broadly speaking, I think it's really important to kind of practice reflection and reflective meditation as well about what this ties into our own sort of human fears of our own mortality, and looking at ways that we are taking care of ourselves. I think especially for healthcare workers, when this is something that's 24 hours a day, it's really, really important to make the psychological space for yourself to not think and worry about these things. I know it's a lot easier said than done, but what I would say is really practicing very intentionally all of the different ways to take care of your body, your mind, your spirit, your feelings, your social supports, to help balance what is sort of understandable fear versus excessive fear. And again, should it be something that is causing a lot of excessive anxiety and impairing day-to-day well-being, then that might be an indication that professional help would be recommended.
I might just add one other point, which is that sometimes the fear of death can be exacerbated by a sense of lack of control. And I think that there are multiple aspects of this particular situation that exacerbate our sense of lack of control. So, for example, this is invisible. We cannot see it. And we're receiving mixed direction in terms of how we can protect ourselves. And so experiencing a sense of control in our life, even in a limited way, for example, feeling confident in the ways in which we're looking to protect ourselves, taking steps to actively protect ourselves. So, for example, adhering to stay-at-home orders, washing our hands, finding spaces where we experience some control in our life can also be a way of decreasing some of that fear for some people.
Great, thank you both. Our last question is, can you explain about intentionality while practicing self-care? And Sonali, I'm going to direct that question to you.
Thank you. So when we think about the actions and behaviors that we engage in our daily lives, those behaviors and actions are always preceded by an intention. So everything we do comes from a place of intentionality, of intention. Waking up in the morning, going to work, it's preceded by an intention. And so similarly, when we think about self-care, it needs to come from a place of intention. We need to develop the desire, the intention to look after ourselves. And so what that means is an active engagement in thinking about what is it that I want to do for myself in terms of my well-being, my self-care? What do I need? And you'll notice, or you may remember that I included a few questions that relate to self-awareness. And so intentionality can start with looking at some of those questions to build self-awareness and then develop your own ideas and strategies for self-care. So all I'm saying here about intentionality is that if we don't have a desire to take care of ourselves, if we don't approach this from a place of intentionality and commitment, we will not then be identifying self-care strategies or engaging with them. So I hope that that's a little bit clearer.
Great. Thank you so much, Sonali. So unfortunately, this concludes the Q&A portion. But thank you both so much, Claire and Sonali, for answering those questions and just for taking time out of your schedules to share your expertise and tips on self-care and team care with us at this critical time. We'd also like to have a special thanks to our colleagues in Learning and Development for their support on the production of this webinar. We would like to invite you to please join us for the next webinar this Monday, April 6th. This is going to be the first of our nursing forum, and it's going to be on personal protective equipment and monitoring. We will be joined by Karen Herring. She's an RN and course lead for the Department of Homeland Security at the Center for Domestic Preparedness, and also by Zach Phillips. He's an RN at New York Presbyterian. Thank you again so much for joining us, and we would just like to extend our best to you and your families and colleagues. Please take care, and we hope to see you on Monday. Thank you again.